Let's talk about monkeypox virus. Is this the next pandemic, or is this something that will go away on its own? So let's take a look at this. First of all, the monkeypox virus presents as a rash which is similar to smallpox. But this is less infective than smallpox. That means less people will be infected compared to smallpox. And the problem here is this virus has a potential for bioterrorism. So this can be weaponized and used against basically humans by bad actors. There are two strains found in Africa. One in Central Africa, which is much more virulent, which is much more dangerous, and one in Western Africa, which is less virulent. The first identified human infection was in the 1970s in the Democratic Republic of Congo. And the people who had infections afterwards, after they discovered the first infection, they discovered patients who had contact with small forest animals such as rodents. Now that's the main reservoir. Now, amongst individuals who are exposed to small forest animals, mainly rodents, now we will talk about rodents a lot in this discussion, but rodents, squirrels, and monkeys, they are the reservoirs and they have led humans also to get infected. The first outbreak was recorded in 2003 in the US, and there were 71 cases in 6 provinces, and these were among people who had recently purchased prairie dogs. Now, these prairie dogs most likely have been infected by rodents which were brought from the African countries. So these patients had indirect contact with the rodents which brought the virus. Let's talk about the latest outbreak. Now, the very first case that we had this year was a man who had traveled to Nigeria and then come to the UK. That was the first case that was discovered in the Western Hemisphere. And then in the US, the first case was a man who had traveled from Canada to Massachusetts. And there were multiple clusters reported throughout Europe. These include Spain, Portugal, UK, and all of these patients were young men. Now, almost all of the cases were discovered amongst young men who are sexually active with each other. And the transmission, there's 2 forms of transmission. The first one is animal to human transmission, and the other one is human to human transmission. So first it must transmit from animals to humans. And it started with rodents. Rodents who would either bite or through body fluids or contact with humans, or actually monkeys. That's why we call this monkeypox virus, because it mainly affects monkeys. And incidentally, it also affects humans. So rodent bites present with more severe symptoms, while tactile contact presents with less severe symptoms. Human to human transmission is mainly airborne. So similar to COVID, this virus, it's also airborne. However, this requires prolonged contact. Usually around 3 hours in an enclosed space is required for there to be transmission. Like I said, this is a less transmissible virus, especially compared to COVID. And the other way is by skin contact or contact with lesion materials, that is, contact with infected materials. This includes sexual contact, and it is theorized that this latest outbreak is amongst a community of people, of homosexual males. That's why it is affecting males. Like all the cases we see right now are amongst males. Previously, there have been sporadic cases which were all related to importing animals, exotic animals from African countries. And the main cause of human cases, as we know right now, is because we do not have smallpox vaccination anymore. This is a virus which is very closely associated with smallpox. And on clinical trials, it was discovered that patients who are vaccinated with the smallpox vaccine are 5 times less likely to be infected with monkeypox virus. And the most common risk groups include males and children under the age of 15. Next, let's talk about the incubation period. How long does it take for the symptoms to develop? So in tactile exposure, that means you touch the animal, such as a prairie dog. The exposure takes around 12 days on average. And if there is a history of animal bites, if the animal bites you or if there is any scratches, then the incubation period, the time to develop symptoms, is around 9 days. What are the clinical manifestations? How does a patient present? Most of the cases are asymptomatic. That means they don't present with symptoms. However, some patients, a small fraction of the patients, present with a characteristic rash. This is known as a maculopapular rash, which can form vesicles. So a vesicle is a fluid-filled sac, basically under the skin, and which can form pustules. Now, I will put up images. However, the patients will also present with fever, chills, myalgias. These are known as systemic symptoms. Then in very severe conditions, especially amongst people who have weak immune systems, there were cases of encephalopathy and retropharyngeal abscesses. Now, what these are includes problems in the brain and on our throat region. It can form an abscess. This time, during this outbreak, the patients mainly have symptoms associated with the genital area. They have genital symptoms, the rash, and the rash begins in the genital area or the anal area. This region is what we see patients presenting with symptom. So the lab diagnosis, when you do lab tests, you see an increased white blood cell count and then decreased platelet counts, decreased albumin levels, and elevated liver enzyme levels known as aminotransferase. And the diagnosis is done mainly through PCR. Similar to COVID, viral infections are usually diagnosed with PCR, and there are other ways. Then we can do something known as ELISA, in which we put an antibody against a certain antigen or a certain structure of the virus. So we take a sample of the virus and then we mix it with this antibody. And if the antibody binds, then it gives out a positive result. Now, this is similar to the COVID rapid antigen test. And then if you were to do electron microscopy on the patient samples, you would see a characteristic brick-shaped organism. So how do you manage a patient with this monkeypox virus? Now, most patients have a mild disease and they do not require treatment. The asymptomatic people and the patients who have a mild disease, they don't require any treatment. However, for people at risk, they will present with vomiting, then difficulty eating. These patients might require intravenous hydration. That means you need to give them fluids. And also there are antivirals that we can use. The first one is known as tecovirimat, which you can use for 14 days. The other one is known as Sidophobia, which can be given as a dual therapy with this tecovirimat. And finally, you have Sidophobia, but there's no clinical data regarding the efficiency against monkeypox virus. So the treatment of choice right now is this tecovirimat